Good to have you back. Let's head back to Hani Baragwanath Hospital. Gareth standing by, of course, to have more conversations around, of course, the work that our healthcare workers do to ensure that we stay safe. Gareth?
Yeah, it's Hani Baragwanath Academic Hospital where we are at the moment as well. Throughout this morning, we've been taking a look at just how empty the facility is. We now know we're into level 1 lockdown. It's going to be changing things, isn't it, Toombs, as we head very quickly towards Christmas. But the point here is for us not to be complacent, because those harder lockdowns, the increase in vaccinations, has resulted in what I've been showing you all morning, and what you can also be able to see, I'm sure, behind me, is empty hospital beds. Remember, that was always the issue with COVID-19, and I think this is when alcohol was taken away. It's why it upset so many people who enjoy their tipple. It was never about taking alcohol away because South Africans are irresponsible with alcohol, or to be fair, we are. The problem was that people drinking and driving and causing accidents were filling up hospital beds, which is why facilities like this then also had to be created to try and help with patients who had COVID-19 that needed that extra help from medical experts to make sure that they don't die as a result of it. Obviously, we know what the mortality rate is in the country. Sadly, a lot of people did lose their lives. But more importantly, Tumelo, is how many lives were saved in facilities like this and will continue to do so. And it's such a pleasure to have two incredible experts with us here on the South African Morning, both of which we've spoken to via Zoom and Teams and carrier pigeon and smoke signals, however we do it now in COVID over the past year or so. It's such a pleasure to have both of them with us in person. First of all, to my left, Dr. Sadna Balton from Wits University, and standing on my right-hand side, I think would be TV left, Dr. Lesley Bamford, Head of Vaccine Implementation from the Health Department. Dr. Bamford, good morning to you. I'm going to start off with Dr. Bolton for Dr. Bamford for the moment, if I can, about how we are doing so far as being able to get the rehabilitation element of this, because now we need to think beyond COVID-19, don't we? How does that start looking?
So firstly, to say that I'm from Hani Baragwanath Hospital, not from Wits University. In terms of rehabilitation, the impact of COVID has caused many issues that we are only starting to see now. From a rehabilitation point of view, many of our outpatient services had to be stopped so that we could focus on seeing inpatients. So one of the impacts is that most of the patients had to wait because therapists had to focus on seeing patients in the ward. So if you think about a child with autism, for example, that child could not come and get services because we had to focus on COVID patients. So we had many parents calling us and saying, we need help, but we could not offer services. So it's about dealing with the many patients that we could not see, as well as the patients who are now dealing with long COVID, in terms of difficulty with respiration, difficulty with communication, and difficulty with eating and drinking, as well as reintegrating back into their work and school environment.
My apologies, first of all, for getting it wrong. Of course, you're not from Wits University, Doctor. My apologies. Can we talk about long COVID? Because now people are going, I'm not feeling great after I had COVID. That's not long COVID, is it? Just tell me what the difference is.
What we are finding is that the amount that people could give in terms of their work environment. I had COVID twice last year. And for myself, it was having to understand that I couldn't function at the same capacity that I could before that. And I think within the work environment, what becomes important is for employers to understand that as well, is that when people come back to work after COVID, it's not going to be at the same level of work for a long while. And it's very different for each person. And that is the thing with COVID. There's no specific pattern that we can say that is the trend. We're learning from the feedback that people are giving us.
And that must be tricky as a last question to you, Doctor, especially I think for employers, because you get booked off, you have to go and self-isolate, you've got COVID, you come back to the office, you should be just carrying on as normal, but briefly, that's not how this works.
Definitely not. And it's important to understand that, to understand the needs of each individual and to also understand the emotional impact. Because people, I think that one thing I'd like to stress is that the emotional impact of COVID on health workers.
And Dr. Sadna Balton, for the moment, I'm going to say thank you very much, and allow me, and thank you for the correction from Chris Hani Baragwanath, Academic Hospital. My apologies. Dr. Lesley Bamford, Head of Vaccination Implementation at the Health Department. Doctor, I'm afraid I ran a little bit over there, so I'm going to give you just a minute and a half if we can talk about this VUMA vaccination campaign. It's really about children, isn't it?
No, it's not about children. The VUMA vaccination weekend is aimed to really accelerate our vaccination rollout in South Africa. The rollout started in May, and we've made good progress. We've delivered over 17 million jabs, and that means that more than 12 million South Africans over the age of 18 have had at least one dose of vaccine. But if we want to continue to keep this ward as empty as it is, we know that we have to accelerate our vaccine program. Our aim is to have vaccinated 70% of adults by December, and we have a lot of work to do to get to that. Over the weekend, led by our president, leaders across the political spectrum, from civil society, religious leaders, will be calling South Africans to action, to come forward and be vaccinated. We have vaccination sites, we have vaccines, but we've been seeing disappointing numbers of people coming forward to be vaccinated.
And the idea of this is trying to just get really that resurgence of that as well, because we've seen a drop in this, haven't we? Doctor, I'm going to have to just say I am terribly sorry. I'm going to have to leave it with you for the moment, but it's the VUMA vaccination campaign as well. I think we'll talk about it as soon as we can a bit later. Dr. Lesley Bamford, Head of Vaccination Implementation from the Health Department, because there is so much to talk about. We just simply run out of time. To both of my guests, thank you very much indeed for the moment.